I know it's been a while since I've made a video. I don't even really know how many people watched my last one, but that doesn't really matter to me. I just wanted to do a quick update. So in my last video I said I may or may not have endometriosis and I was getting my laparoscopic surgery. Well, I had the laparoscopic surgery September 2nd, and they did find endometriosis. They found 2 rather large patches, which they removed by excision. And then I had a smaller patch on some blood vessels that they weren't able to get to because they didn't want to cut the blood vessels. And then they said the rest of my pelvic cavity looked like someone had dipped a paintbrush in endometriosis and just kind of splattered it everywhere. So they burnt off those smaller lesions, I guess you would call them. So after my surgery, things were going well for a while. I wasn't having as much pain. I had a flare-up in November after my surgery, which was during the time of my period, which I was very thankful that it was just then and it wasn't all the time like it had been previously, but it was still pretty severe to the point where I needed tramadol to control the pain, and I still needed to be on Zofran for the nausea, and the exhaustion was still terrible. And so I had that flare up and it kind of eased up, and then in January I had another flare up around the time of my cycle. Right after my period finished, I went on Depo-Provera because previously my OBGYN had said that Depo-Provera would stop my periods and it should stop my pain because it's stopping my periods. So I did that and things were going okay, except the pain didn't stop. My period stopped, I didn't get my next cycle, but the pain never stopped, and it actually kept getting worse. So I went in and saw my doctors. They pretty much said, well, we don't think the Depo-Provera is working for you, and even though we just gave you the shot a week ago, here's some birth control pills, take those. And that was when I was in crying with pain to my doctor, and he gave me birth control pills and actually no pain pills, not even ibuprofen or anything like that. So needless to say, I ended up going to the emergency room because the pain had gotten so excruciating that I just could not deal with it anymore. The emergency room did the typical ultrasound, pelvic exam. We've all been there. Of course, didn't find anything out of the ordinary. They thought it was just my endometriosis coming back. And so they told me to schedule an appointment with my OBGYN. Now, normally that wouldn't have been an issue. However, I'm in the Navy and I was supposed to go on deployment 2 weeks later. I guess at that point it would have been 3 weeks later. So it was kind of a time crunch to get into my OB. And I was finally able to get in about 10 days before I was scheduled to go on deployment. So I talked to my OB and told them everything that had been happening. And they told me that pretty much my last option before getting a hysterectomy or trying like nerve blockers is Depo Lupron. So it's kind of gotten to the point where I've done a lot of research on Depo Lupron recently. I know all of the terrible side effects, and I know that for some women it does work, and for some women it leaves them worse off in the end. But for me, it's gotten to the point where I can no longer do my job because of the pure exhaustion and the pain and the nausea and everything. It's just terrible. I can't do anything. And I'm not a normal 23-year-old anymore. So I decided, you know what, Depo Lupron is definitely going to be something that I at least have to try. So I got the Depo Lupron injection, I think on the 27th of February. And along with that, the OBGYN also said I should not go on deployment because they want to make sure that their treatment works, that the Lupron actually will control my pain before I'm in the middle of the ocean somewhere and I don't have an OB around. So that's where I'm at right now. So it's been about a week and a half since I had my Depo Lupron shot, so I'm still in the upswing of the estrogen before it starts to drop, because that's how it works if you didn't know. The first 2 to 4 weeks after you get your Depo Lupron shot, I got the 3-month shot. The first 2 to 4 weeks, the estrogen actually rises up, so you see an increase in your endometriosis symptoms before you kind of get the temporary menopause. And that's where I'm at right now. So the pain has gotten worse, and it's been pretty terrible. I've had a lot of joint pain as well, which from what I've read is normal. It kind of feels like I have the flu without actually having the flu. Like, that's how my body feels. My normal endo pain is pretty bad. I'm on Vicodin for the endo pain. So that's helping, but Vicodin makes me very exhausted, so I try not to take it often, especially because I still have to go to work every day. But the exhaustion has been debilitating to the point where as soon as I get home from work, I'm just bedridden because I don't have the energy to move. I don't have the energy to do anything. And like right now, I just got home from work and I sat on my couch and I haven't even taken my uniform off yet, and I'm drained, and I don't know how I'm gonna make it through the night without having to take a nap, and it's gonna be extremely difficult. But I'm kind of hoping that because the Depo Lupron is making my symptoms worse like it's supposed to, that means that it'll make it better like it's supposed to. But I won't know for another couple of weeks if it's actually going to make a difference, and it might help while I'm actually on the Lupron, but who knows, as soon as I come off of the Lupron, it might be just back to the way it was again. So really, I'm kind of in limbo right now. I'm going to be on LIMDU, so for those of you in the Navy, you know what that is, but for those of you who aren't in the Navy, it pretty much means I'm going to be in like a holding job for now. So I'm still going to be in the Navy, but I'm not going to be doing the job that I actually signed up for. I'm going to be more in a position to focus on my health. So that's going to be good because I also have a kidney issue that I have to get checked again. I have a compressed left renal vein on top of my endometriosis, and they think that my kidney is just going to fix itself, but they're not sure, so I have to get another contrast CT done to make sure that that's fine. But yeah, that's pretty much how Depo is going, or Depo Lupron is going for me so far. I hope that can kind of help some people. I will try and make more updates about how the Lupron is going, maybe every couple of weeks or so. Also, in addition to the Lupron, I'm also on an add-back therapy. It's, I can't even remember the name of it, but it's a progesterone add-back. It doesn't have any estrogen, it's just progesterone. And that's supposed to minimize the amount of hot flashes and everything I get. And I've actually been on that since the first day I started Lupron. So hopefully that's going to minimize the amount of menopause side effects that I have. But like I said, I won't really know about that stuff for a little bit still. But thank you guys for watching. If you want me to post an update or post a more specific video about something, just go ahead and let me know in the comments. It is Endometriosis Awareness Month, so if you do have endometriosis, please try and make other people aware that it actually exists and it sucks. And people don't understand, they just don't understand what it's like to live with a condition where your body is fighting you. And more people need to be aware that this actually does exist and it's terrible. If you don't have endometriosis, then I guess you're already being aware about it because you're watching this video. So high five. But that's pretty much it. So I hope you guys have a good day, and I hope you stay pain-free. But if not, grab your heating pad and just cuddle up with it and try and make it through the day like I try to every day. All right, bye.